My name is Fulgencio-Turner. I direct the Climate for Health program at ecoAmerica. So ecoAmerica has different programs aimed at connecting with the faith, health, and community sectors on different ways that we can help people on the ground connect that climate change is happening, that they can protect their health and their communities from it, and that they can help to drive solutions forward. So we're so proud of this coalition and to be joined by the American Public Health Association and our other partners on co-hosting this webinar. Great. So I won't spend a lot of time on this, but this just shows quickly the increase in heat over time, starting in the 1800s, and it keeps on freezing. But so again, I'm going to just drag this forward. We know what happened. The concentrations of CO2 caused primarily by burning fossil fuels is causing global temperatures to get hotter and hotter, um, really kicking off in the 2000s to the point where now this is 2023. You can see that there are just really significantly, it's much, much hotter than it was before we started burning all of those. And this, of course, is significantly affecting our environment. And so heat is the most dangerous weather-related health phenomenon, health risk. Currently, over 1,300 people die each year due to extreme heat just in the United States. And these impacts are projected to continue to grow and grow over time. There are disproportionate health impacts for people who are exposed to greater amounts of extreme heat. This especially includes outdoor workers, people who are unhoused, and people who don't have air conditioning or shelter or ability to cool off or find cooler places. One of these statistics that really blew me away is that construction workers are 13 times more likely to die from heat-related illness than the average worker, and farm workers are 35 times more likely to die. And you can see that these impacts that as it gets hotter, your body responds to that extreme heat by first starting to sweat, sending blood to the periphery. And if that doesn't cool you off fast enough, your blood volume will drop, and that is what causes heat stroke and can lead to organ damage and more significant health outcomes. And the impacts of extreme heat, people with the pre-existing health conditions are especially at risk, including diabetes, heart disease, dementia, COPD. That folks currently struggling with health issues, those extreme heat days bring tremendous risk. So in this moment, your leadership on this really matters. We need to help people to connect that these climate impacts are affecting our personal and public health right now. This is the number one motivator to help people get connected on ways to take action and to join more of their community members in addressing those severe impacts. So I'm just going to take a moment to introduce our panelists before I hand it off to them to talk about those local solutions. So I will be really brief. Starting off, I'll introduce all three. And again, if you have questions throughout their presentations, please put them in the Q&A box. We'll be reviewing those and trying to get to as many of them as we can at the end. So our three presenters will be starting off with the Americares Director of Climate Resilience, Nathaniel Matthews-Trigg, or Nate Matthews-Trigg. So he is part of a team that develops innovative global programming at Americares that prevents and addresses the health impacts of climate change. He works closely with health providers and clinic staff serving low-income and uninsured patients, ensuring that they have the resources to protect the most vulnerable patients from hurricanes, wildfires, flooding, extreme heat, and other weather events intensified by climate change. Next will be Reverend Katie Sexton, who leads Arizona's interfaith network called Arizona Faith Network, where she leads projects to combat homelessness in the desert heat. Reverend Sexton has a proven record of building impactful communities who work to transform our world for the common good. She's worked throughout the region in a Coolwater Christian Church in Scottsdale. Yeah, she also worked for Grand Canyon University, developing critical relationships and clinical partnership opportunities for students training in the College of Nursing and Healthcare Professions. And finally, from the American Public Health Association, we'll have Shweta Arya. She is the Senior Project Manager for Smart Surfaces at the Center for Climate, Health, and Equity at APHA. So she has been creating cross-disciplinary partnerships, working especially in underserved communities to encourage cities to address and prepare for the health risks associated with extreme heat and excessive rain, and to reduce health disparities by implementing these solutions. So again, thank you in advance to our three great panelists. I am going to go ahead and hand it off to Nate to get started. Nate.
Great. Thank you so much, Ben. It's a real honor to get the invite to speak to you all today, especially on such an important day around heat awareness and action. So let me share my screen. Okay, thumbs up. Can people see that? Amazing. Okay. Again, it's a great honor to be here. I'm going to start by just speaking a little bit to Americares and what we do as an organization. And then I'll get into some of the resources that we've developed to support frontline healthcare providers, especially in the US. This is FQHCs, federally qualified health centers, and free and charitable clinics. So our mission at Americares is to save lives and improve health for people affected by poverty and by disasters, so they can reach their full potential. Because we really envision a world in which all people have pathways to health and to opportunity. So Americares, we support local health centers and clinics, which help provide and meet the needs of their patients and the communities, both in times of disaster, but also in everyday healthcare settings. So I would describe Americares as an incredibly collaborative organization. We have an incredible network of local, national, and international partners. In the US, we have close to 1,000 partner clinics and health centers. And in the US, it's about 4,000 globally. So jumping into it, I think our climate work is most known around this toolkit, which we call the Climate Resilience for Frontline Clinics Toolkit. It came together as a partnership between Americares, Harvard Sea Change, which stands for Center for Climate, Health, and the Global Environment, and then our clinic and health center partners who helped us develop this incredible suite of resources. So this toolkit really helps providers talk with their patients about around certain climate-related hazards. This is flooding, hurricanes, wildfires, and heat. And I would say our heat resources have gotten the most attention because, as we know, the risk and the exposure to heat is increasing everywhere. So we started this toolkit project by doing a survey of clinics and health center staff across the US. And they really pointed to a need, a gap in resources for providers to understand how climate change is impacting their patients, resources for patients to understand how climate change is impacting them and actions they can take to protect their health, and then also resources for clinic and health center administrators on how they can build resilience to increasing frequency, intensity, and duration of certain extreme weather events. So the toolkit is now fully available in Spanish, and I anticipate in future years we will have additional languages, but we really heard from the clinics that they wanted resources that were accessible to their patients, both in kind of the language used, making sure it provided really practical information, and also in languages that were needed to reach their patients. So here's just one example of what we offer in the toolkit when it comes to heat resources for patients. We've got lots of really great infographics that we spent a lot of time on, which we really believe, and we've heard from the clinics and health centers, provide really important information in a clear way for patients. You know, small tangent, but when you look at guidance often on the difference between heat exhaustion and heat stroke, there's often a lot of overlapping symptoms, and that we know creates confusion around at what point does excessive sweating, go away and then heat stroke occurs. Oftentimes, someone will go quickly from heat exhaustion to heat stroke, and there's a lot of confusion. So we really wanted to clarify what that looks like and provide really practical information. We also have this urine chart, which helps people understand how to tell if they're hydrated enough for extreme heat events. And then also we wanted to add, right, signs of acute kidney injury, which often a lot of the guidance doesn't talk about. We also provide information on what patients can do in the face of extreme heat, and kind of a template for providers to talk with their patients and do this like action planning, which we know is so critical for people to feel empowered. One example is providers should ask their patients, Who are you going to call if it's too hot in your apartment? And write that number down. Or where are you going to go if it's too hot in your apartment and you need to go somewhere else? These sorts of concrete actions are really critical for people to make behavior change. And then this here kind of gives an example. This toolkit is available on our website now, freely available. You can access kind of general weather guidance that really helps clinics set up a system in which they can monitor the weather and kind of what the roles are of people within a clinic or health center setting. And then you can see the different hazard modules: extreme heat, wildfires and smoke, hurricanes, and floods. All right, and our second resource that's also freely available on our website today is creating customized wildfire, smoke, and heat health action plans. And the motivation behind this was really, we recognize the incredible role that clinics and health centers play in their community. They're a trusted source of information. They understand their patients' unique needs and health conditions. They often understand the barriers that patients face to staying cool during the summer or accessing clean air during a wildfire smoke event. And also, these clinics and health centers have contact with patients and community members that are often socially isolated and are very difficult to access in any other way. So we developed this project because we realized that our toolkit helps clinics and health centers really connect with their patients during the patient visit. But there's a role that communities and clinics can play in being part of a broader community response. How can clinics and health centers leverage their relationships, leverage the unique role they play in the community to support local emergency managers, local public health, other organizations that are looking to support, faith-based organizations, for example? How can they work together to develop systems that protect those who are most vulnerable? So in working with many clinics and health centers across the US to develop this, the final product is an assessment form that clinics and health centers, but others can test it out. You fill out this form. It takes about 5 to 10 minutes. And it asks some basic questions about, who are the patients that you serve? What are your resources like? What's your staffing like? And based on how you fill that out, we generate automatically a plan that helps your clinic or health center or community organization understand the top 5 interventions we would recommend based on how you filled out the form, but also based on where the evidence is. What actions can you take that are supported by evidence? There are case studies to support it for you to learn from. And what can you do to be part of that community response? And if you go and fill it out, there's also videos that talk about the threats of extreme heat and wildfire smoke on clinic and health center operations. There's also some guides on how to use these action plans. There's a lot of resources that we really want to get out there so that they can help communities, they can help people that want to do something and really make a difference and protect health. So those are all available. I have a QR code here, so you can go straight to our website via this QR code. I believe the website is also in the chat. And feel free to reach out if you have questions, concerns, comments, or you want to explore opportunities to partner moving forward and advance a lot of the things we've developed already. All right, thank you.
Thank you so much, Nate. Yeah, it's really, really exciting new resources being rolled out, tested, and available to everyone to bring to your health providers, to your community, and to scale these resources up. So really excited to be able to share those. Next, we will ping it right over to Reverend Sexton. Reverend.
All right, can everyone see my screen? Awesome. So good to be with you today. As it was shared, I'm Katie, and I serve as Executive Director of Arizona Faith Network, which is an interfaith network for the state of Arizona. We are really lucky in Arizona to have such a phenomenal relationship across our state with our government, our nonprofit partners, and our faith-based communities. A quick shout out to Dr. Eugene LeVar, who's on the line today, the first ever state chief heat officer that was created under Arizona. And we have so many more things to share about what Arizona is doing, because it is hot here, except ironically for today, it's been raining. But today I'm here to talk about the role of faith communities in heat relief. And so you might be asking why a clergy person is on talking about heat relief and what this has to do with faith communities. But faith communities are really uniquely positioned to serve as heat respite, cooling centers, and crisis response centers. First and foremost, there is probably a faith community in your neighborhood or in a neighborhood close to you. So we have a distribution of locations. We're grounded in place and purpose. We're not newcomers to responding to emergencies and disasters. And we are rooted where we are. Churches, mosques, synagogues, temples exist pretty much in every neighborhood, including rural and under-resourced communities. So these are areas and leaders that have relationships across every neighborhood we are trying to reach out to. We also know our neighbors and we know our neighborhood. Our communities, our faith communities know what's going on. We know what the concerns are of the neighborhood. We know that, the house down the street might really be in trouble right now, or this neighbor is really struggling. And so we have this really localized knowledge that is an expertise in being able to reach out to those who are going to be the most heat vulnerable in our communities. We have community trust. We've heard over and over again from our respite centers. AFN runs anywhere from 10 to 17 different heat respite and cooling centers every heat season, which for Arizona is May through October now. And we see about 48,000 visits throughout that season through different partnerships across the city, county, and state. And we have heard over and over again that trust is the difference between someone walking through that door and coming and getting the help they need, and someone staying outside and potentially getting sick, ill, or dying in that 115 plus degree heat we see every season. Our faith communities are embedded in the daily lives of our neighborhoods. They're familiar, they are trusted most of the time. And we have seen how this trust opens doors to community members that would never walk into a government building, perhaps, or come into a church or go into a library because of the vulnerable position they find themselves in. So this community trust is really essential to ensure that the folks are getting the help they need. It's not that the faith community themselves will be providing every solution, every answer, every resource. That's where you partner. But for the vulnerable populations who feel like they're going to be judged or not comfortable in other spaces, faith communities can really open the doors to be able to practice non-judgments, presence, and safety. We also are hubs of networks. We are a place, as I said, where we can bring together our public health experts. We can bring together a vaccination. So at our hubs right after COVID, we were able to bring out public health and have our sites be places for the COVID-19 vaccinations to be distributed. We are connected to other congregations, other folks that are looking to help volunteers serve and respond. We are connected to neighborhood coalitions, alliances, services, ministries, and often we know how to mobilize quickly and to be able to be a bridge across those traditions and coordinated efforts that can be grounded in relationships by being rooted in the places we are in. And probably the most obvious is we have the space. There is space within faith communities to be able to offer relief, to let folks come in, cool down, and get access to the resources they need. We've also seen as faith traditions are declining in some areas, we have some really big buildings that are not being used for things throughout the week. And so making a partnership with localized public health and other resources and government to be able to respond to heat crises is a great way to use space that is not being used in faith communities. And of course, we have our moral and spiritual obligation. We don't just step into this work because it's convenient or it's easy or fun, although it can be, but because we know that in our tradition, our faith requires us to reach out to our vulnerable neighbors and to help respond when our neighbors are in trouble. So through that and our values-based action for change, we have been able to really build a phenomenal program here in Arizona with our government and nonprofit partners that just is able to reach across so many barriers and get to those that are the most vulnerable in our community. And so I think we've been doing this goodness for 5 years now, 5 or 6 years now. We are able to run and open doors to so many in need. And with that, I'll be available for questions, but I'm going to pass the microphone right now to Shweta.
All right. Thank you so much. It was really great to hear from Nate and Reverend Katie. I just want to thank you, Ben, and Climate for Health, ecoAmerica, for this opportunity today to talk about our work. My name is Shweta Arya. I use she, her pronouns, and I'm with the Center for Climate Health and Equity here at American Public Health Association. And I currently work on our smart services work, so I'll be taking this conversation to the urban cities and where we feel more and more impacts of extreme heat. So bear with me till I pull my slides here. No, Ben, stay with the first slide. Oh yeah, second slide is good. Okay. Yeah, I think I just want to have this. Let's move to the presentation overview, and here are a few things that I will go over in my presentation. We already talked about the serious physical and mental health impacts of extreme heat, especially in vulnerable communities, so I'll just browse over that. But moreover, I want to spend some more time on urban heat island effect and how it's getting worsened, how is it worsening in our cities, and who's getting impacted. And then we'll talk about the solutions and, how can we build our cities in a more smarter way so we are able to deal with extreme heat. So let's move on to the next slide, Ben. So we know our planet is heating up fast. Every year, it seems like it's breaking the past year record. Extreme heat is a national public health emergency with rapidly worsening impacts across the United States. It is also a leading cause of weather-related deaths in the US. Before I got into this work, I never really thought that extreme heat kills more people than all natural disasters put together. Hurricanes, floods, wildfires combined. In 2023 alone, it claimed more than 2,300 lives. And that number is very conservative. The actual toll can run in thousands because we are not tracking our heat deaths properly. So that's another conversation for another time, that we need better surveillance to track the heat deaths. But let's also talk about that this is not a natural phenomena. It is a human-driven crisis. So the primary driver of this rising global temperatures is the burning of fossil fuels. So we definitely have to think about reducing our, fossil fuels usage, parallel to this conversation. But I want to just bring that out, emphasize that that is the cause of this rising temperature. So we definitely need to address the elephant in the room first. So as a result of that, we're seeing more frequent and intense heat waves, which pose serious public health risks: heat stroke, respiratory distress, and even death. But we also want to talk about that every single heat death is preventable. If we take precautions and be prepared for extreme heat, we can save these lives. And that's why we are having this conversation here, right? So definitely there are health impacts, but let's talk about the economic toll, which is also staggering. There are higher and higher energy bills that we are seeing every summer. We see lost worker productivity, increased pressure on healthcare systems. One of the study says that we see $1 billion in excessive healthcare costs which is just really just because of extreme heat. And as with many climate impacts, the burden falls hardest on communities that are already under-resourced and overexposed. So let's go to the next slide. Just again, extreme heat, as Ben shared in his slide, we are not meant for this kind of temperatures, exposing ourselves to this kind of temperature. It comes with physical health risks like heat stroke, dehydration, and worsening of chronic illnesses. They're increasing emergency room visits. We see that every time there are heat waves coming in, we see our emergency room visits are peaking as well. So increased hospitalization and mortality, especially among the vulnerable population, our elderly, children, outdoor workers, pregnant women. And then let's not forget to talk about the mental health impacts. There are clear connections that when we see extreme heat rising, we also see violence rising in our community. So, we see heat linked to increased anxiety, aggression, and mood disorders. So and there are a lot of health inequities. So we see a whole lot of health impacts. And then let's shift our focus to the urban heat islands. We know that due to rapid urbanization, think of our cities right now. If you think of our cities, they look like urban, they look like concrete jungles. They have roads that are paved with dark asphalt. Buildings are made up of heat absorbing concrete. We have dark roofs, and they all are trapping heat and causing urban heat island effect, which can really add 5 to 10 to 20 degrees in some of the urban neighborhoods. And we know that 80% of US population resides today in urban areas. So we know that our cities are very dense and they're getting hotter. So it's really important to see, can we change the strategies, how we are building our cities? We can't be relying on air conditioning alone. We need passive cooling technologies like smarter surfaces to reduce the risk and build resilience. So I'll be talking a little bit more about these passive cooling technologies. We know that as we see global temperatures rising, we also see our air conditioning use are rising, and it really puts us back in that feedback loop. We are using fossil fuels to cool our homes, and it's emitting more pollution and it's heating up our environment. We are really getting ourselves into that feedback loop. So we need to use all kinds of different strategies to cool our cities. And we see disproportionate impact. So it's not hitting everybody equally. So we see low income and historically marginalized neighborhoods often have fewer trees and green spaces, more heat retaining surfaces. They also have less energy efficient buildings. These communities also tend to lack access to air conditioning, healthcare, and emergency services during heat waves. So we see compounding vulnerabilities in these communities. Next slide, please. So that brings us to the solution part of this is, can we have smarter surfaces? Can we build our cities in a more smarter way? Smart surfaces are transformative infrastructure technologies. They're highly reflective, they're highly permeable, and they're designed to make our cities cooler, healthier, and more livable. So we see more co-benefits like health, equity, and climate. Next slide, please. So the Smart Surfaces Coalition is made up of more than 40 leading national and international organizations. APHA is one of the founding members of this coalition, and we have a shared commitment to creating cooler, healthier, and more resilient cities by cost-effectively reducing the impacts of heat and flooding in urban areas. Next slide, please. So Cities of Smart Services project started a couple of years ago, and it is a 3-year program ending this year, where we really created this proof of concept, and it really shows how collaborations can really work in a fruitful way to change policies, in cities. So here we have 13 partners working together with the cities. Next slide, please. And really helping them transform their built environment utilizing smart services technologies. We have funded 6 of our APHA affiliates to work in 6 of these cities. There are Florida, Georgia, Louisiana, South Carolina, North Carolina, and Oregon. And next slide, please. And here are the 5 buckets on which we work with the cities on. So we work with them on data visualization and cost benefit analysis to really have a more data-driven approach to so that the cities can create a financial and economic and health argument for these smart services adaptations. We also, data alone cannot move policies. We need community voices. So there are partners like APH affiliates, like Metropolitan AME, faith partners who are working in the community, creating awareness around smart services or extreme heat, and working to advance these policies, where there are partners in the coalition who are working on federal funding. Now we know that federal funding is looking really different this year than it looked in the past administration. So definitely there are challenges that we are trying to work around. The next bucket is policy and legal advice. So there are partners like Columbia Law School, NASIO, NLC, who are really working together with these cities to create a policy tracker tool, which really helps them navigate what are some of the other smart service policies that have been adopted all around the country, and there are some policies also around the world as well. What are making sense, and can we learn from what has been practiced in another part of the country, and how can we use those tools and provide those tools to our cities. And the goal of this coalition's work is we create the infrastructure in a way that it can be used by cities and municipalities beyond this project as well. And there are other partners like Harvard-Chan who are also doing some health research and working on communications. Next slide, please. And I'm going to just talk briefly about APHA's affiliates works. As I said, 6 of our APHA affiliates were funded to work with the cities on this. And how they're working is they're building local cross-disciplinary partnerships, like with faith communities, like Reverend Katie was mentioning. We really see faith communities as as on-the-ground partners to work together to gain that trust. In my previous life, I used to work with faith communities in Delaware. So I really think them as trusted partners to build these partnerships, to gain community trust, engage and educate communities around smart services, around extreme heat prevention, and then working together with city government, to promote public health messaging to guide citywide climate policy. Next slide, please. And I can give a few examples of how our affiliates are advancing smart services. I can give an example of North Carolina Public Health Association. They are developing public health dashboards for City of Charlotte. for their 6 corridors of opportunity. They've picked some heat vulnerable communities, and they want to support advocacy and city planning work with them. They're partnering with Clean Air and C, which is a environmental and community-based group, and they're doing focus groups with them this summer, and they will take the input from those focus groups to inform the comprehensive heat action plan that the city will develop. Another good example is South Carolina Public Health Association, which is facilitating a coalition of statewide partners who are focused on the extreme heat and flooding work to drive collaboration. They're also providing small mini grants to support smart services research and local implementation projects. They're working with students who are doing some research. They're working with community-based organizations who are doing a cool mural with using reflective paint, which is really exciting to see. And lastly, I want to talk about Georgia Public Health Association. They partnered with their local university, Mercer University, and a local faith-based organization, then again to conduct these focus groups, to get the community's input. And as we speak, Atlanta's Cool Roof Ordinance is having its public hearing. Our executive director at GPHA was able to go at one of the community hearings and really talk about the importance of such cool roof ordinance in mitigating extreme heat at the city level. And next slide, please. And now I can just quickly go over some of the resources that we have for you on American Public Health Association's website. Please check out. We have an extreme heat resource hub, where we curate all the great work, like Americares toolkit is included in there. Any upcoming webinars or tools or trainings or resources. So we've really pulled together all those in one place, and it can be a great resource for health professionals, community leaders, and advocates who are working around extreme heat. We also collaborated with Columbia University's Mailman School of Public Health to create this toolkit. This toolkit also has guidance around how you can conduct your focus groups. Some of our affiliates were able to excuse me, utilize the toolkit to conduct their focus groups. So please check those out on our website. Next slide, please. And I'm really excited to share about our new Extreme Heat podcast series. It's a mini series. We're calling it the Heat RX, and the first episode should be out sometime this week. Please follow the Nation's Health podcast. And the first episode is focused on smart surfaces for public health. So please tune into that. Next slide, please. Oh, sorry, did I just skip the the training? Sorry.
Yep, go for it.
Okay. Yeah, so we're very excited that we are collaborating with ecoAmerica, Climate for Health, on this extreme heat and health training. I think this can be a really great opportunity for public health officials, clinicians, advocates, community leaders to really, dive in and learn more about how to prevent, treat, and communicate about heat-related illness, how to build your skills around that. You can get 3 free continuing education credits. It's on July 24th, 1 to 4 p.m. Eastern. So please register for that. We've put in a lot of hard work, and we have lots of people who are on the review panel, including Nate from Americares. He's on the review panel as well. So we have lots of experts looking at this content, and we really wanted to produce something that can be meaningful in training the workforce and training our folks to prevent heat illness. And lastly, I want to just end with a call to action. I want to talk about this alliance that we are part of. It is made up of, it's called Alliance for Heat, Resilience, and Health, made up of health and environmental partners like Medical Consortium on Climate and Health, American Lung, NRDC, Federation of American Scientists, working together in addressing extreme heat as a health emergency, and we've been working together since 2023. We work together in support of OSHA's heat rulemaking. We created a letter that was signed on by 80 organizations around the country. We sent 800 comments in support of OSHA's heat rulemaking. I know that they are starting their public hearing in June 16. So if you were signed up to speak, please remember to show up and speak to support. We need a national rule to protect workers around the country. And so right now we're working on a governor's letter, advocating for governors to prioritize extreme heat preparedness, because the reality is that we know that not much is going to happen at the federal level. We really want our states to take that lead. So please check out the governor's sign-on letter. We're inviting state and national health partners to sign on. And we will take this letter to National Governors Association in July in Colorado and present that. And hopefully state partners can then take that to their own governors and work on some of those priorities. So I can share that letter in the chat. And my last slide, I just have my information here. That's my email. If you have more questions, please reach out to me. Please sign up for our APHA's Climate Center newsletter. That's a quarterly newsletter. And we also like to update everybody on upcoming events and trainings. So that is up for me. Thank you so much.
Thank you so much, Shweta. Gotta say, I'm just so excited to have all of these resources available here, and that both the chat and the Q&A have been very active. So we have about 16 minutes left. So I'm just going to try to dive into a few early questions to our panel, and then we will switch over to the group. So just kicking off. So in your experience, asking anyone who wants to start off answering this, what role does trust play in successful heat response efforts, and how have you built that trust within communities?
I spoke a little bit about this too, but trust, when you're doing the direct service to outreaching to the vulnerable communities, showing up as government or a nonprofit or institution folks have never heard of is not going to necessarily open doors and allow you to have a real trusted relationship with that community. That's why it's been so critical for our heat relief network here in Maricopa County and in Pima County to be working through our nonprofits and faith-based partners that are already on the ground, already known to neighbors, that can be those trusted messengers. It really can make the difference between life and death in a lot of situations here in our crazy, crazy hot summer in Arizona, on whether people will access resources or not, for them to be able to have that ability to trust the person that's talking to them. And so letting them know that your agency is working with people they already know and they already trust, and they're not coming in to kind of drop in, throw some resources, or just survey them when they're already hurting. I see a lot of agencies over the years try to do that, try to go out and ask people who are hurting in the heat a bunch of questions about hurting in the heat and not offering any relief. And that is not a way to approach people that are in need. It has to be in relationship and provide immediate relief to their suffering.
Yeah, I'm happy to jump in. So trust, as the Reverend mentioned, is critical, and it's something that's earned. It's not given. It really takes listening to the communities, treating them as equal partners, ensuring their voices and experiences really inform the work you do, and it's showing up. I am very happy to work for an organization that has done that for many years. So our partnership and trust and relationships is quite strong. But we also recognize that trust takes time, and you can't, as the Reverend said, you can't just drop in somewhere without those relationships and expect for people to trust you. So we really prioritize working through local community partners when we respond to disasters if we don't already have the trust in those communities. And what we really recognize is those community partners that have the trust, they often are that incredibly important conduit between outside resources and information getting in and making sure it aligns and is useful and applicable to the frontline communities. So federally qualified health centers, free and charitable clinics, these are institutions, anchor institutions within communities that have been there and have been supporting their patients and their communities. They have the trust, and we partner with them to make sure what we develop is useful for them and their patients.
Thank you so much, Nate. And I really want to kind of highlight that point around these connections across sectors with community groups really being critical. I mean, having worked in safety net healthcare for 15 years, if I was working on a food assistance program or a chronic disease education program or health insurance enrollment, if I was not connecting with the local faith community or local civic groups that have deep ties in those communities, I was going to fail. I was doing a bad job at my job. There is no way to be effective in this public health work without ensuring that you have ties and take the time to build trust in those communities, and with those groups. And I think that kind of leads into my second question is, um, what is your advice to do that well? So how do we do better at coordinating across sectors? I mean, I am speaking from the public health and safety net health lens, but in any direction, what can we do better to make sure that those connections are growing and supported?
I think it starts with inviting folks to the table at the beginning, and not making assumptions. Um, Sitting with community members, again, the folks that are heat vulnerable, that are living this every day, that are suffering from heat, are the ones that need to be naming what their needs are, and what they are struggling with. And the response needs to be created to that, not assumptions of what the public health response should be. From someone who's sitting in a nice air conditioned office somewhere. Like, we have to be out in the community, really asking and being in those trusted relationships, asking folks what their needs are, and then allowing them input on the design too. That does both things. It creates a cross sector response, and it creates trust. So you're going to get more community buy-in by involving them in the process.
Yeah, I agree with everything Reverend Katie just said. And for we know from research the health professionals are like faith leaders, really ranked really high when it comes to trust building. So that's why we really encourage health professionals to be there and use their voices in building that trust with community, because community do trust them. So using their voices and doing that. And we have one of the biggest successes for this project is that from the very beginning we have built in community engagement. So community engagement has to be built in from the beginning and not towards the end when you form up those policies. So having that community input, like we had with focus groups, having that community input inform some of those policies, and continuing that collaboration really, really helps and in grounding this work.
Great. Anything to add, Nate, or you already covered it?
Yeah, I think I covered it, and I fully agree with what everyone said. It really resonates. I mean, whether you're talking about the healthcare sector or you're talking about the faith-based community, like many of the challenges that we face are the same, and also like the opportunities and the exciting potential is there for us to really partner not only within our sector, but also across sectors to really create interdisciplinary coalitions that can really make things happen.
I wanted to just highlight one more point. So I was talking about our governor's letter where we talked about the whole of government approach, and Reverend Katie pointed to their chief heat officer, and having we've recommended that in that letter is having a lead officer working around heat who could really create a collaborative team at the state level, bringing public health, bringing community leaders, and bringing everybody to the table, really centralizes that, coordinate that work, and really empowers people to speak to each other. So I think that, that's one thing that I would suggest, that, wherever the heat work is happening, having, creating that table and inviting everybody in, and maybe creating a heat lead at the state level can really help.
Yeah, and just to thank you for bringing that up, because I don't know why I didn't say this up front, but we have just an amazing state and county-wise heat relief network. We meet weekly, bi-weekly, monthly throughout the entire year, and we know our heat in Arizona is different than a lot of places across the country, but it's everyone from individual cooling center providers all the way up to Dr. LeVar at the state level. We have hundreds of people. We have EMS on there. We have our physicians on there, public health, and we take that time to talk about what's going on the ground. And that was first coordinated by Arizona State University, some work for Maricopa County, but has been taken over as these positions have come to life, to be held up both by city, county, state, and still some university leadership as well. But it's been just absolutely critical to respond.
This is great. And I think it goes to one of our questions that was opened as well, is that these kinds of moving up the ladder upstream policy actions with your coalition is also a way to cement really needed trust and relationships that the interventions can continue to get built on. So you're both building what you need for those communities while also supporting them in a way that shows a real commitment and relationship. So the last question I have before we go and get to any more in the chat that we have time for. So for folks that are new to this work, they came here because they care, but they haven't been leading on this already. What is one actionable step they can take today to support heat preparedness in their own communities?
I'm happy to start. The one priority action I always recommend is getting to know your neighbors. Oftentimes, the difference between life and death during an extreme heat event is whether someone knocked on the door and checked on an individual. So, we have to take care of ourselves. We also have to take care of our community. And doing that is really creating community and getting to know people around you who might need support, letting people know if you need support, and really kind of working together. Because too often in an individualist society, we always think about the individual, and we forget that there's so many barriers people face to doing so many of the things that can save their lives, and that we really have to work together to adapt, to build resilience to these hazards that are becoming worse.
Yeah, I second that. Just very, very simple steps can be, if you are a business, if you are a nonprofit, we talk about opening your doors when you're already in the office. So if you're a faith community, when you're in the office every week, just putting a sign on the door and saying, hey, we got cold water here if you need to come in and get cold water and sit down. Again, heat is different in every different state we're in. What that looks like is different. There may or may not be a network to tap into to run that type of hydration or cooling center. The other thing is carry cold water with you. I do that in the car throughout the summer. Freeze water. Out here we freeze it because it's gonna melt very quickly, and carry little heat relief packets in my car. Those are great little outreach projects for communities or your friend group to sit together, or your family, and pack, and just carry it with you and hand it out to folks who are on the street, and redirect them to where they may be able to get more help in those immediate heat spikes.
Thank you. I agree with all of that. And I just want to put in a plug for our upcoming extreme heat and health training. It is in July. We'd really love for folks to put that on their calendars. We're creating these resources and trainings to really get people, trained around heat and take it seriously. It is really meant for, um, public, not only public health folks, but also clinicians or, community leaders. So please check out that training. We also created that Extreme Heat Resource Hub that can be a really great place to start. So please check those out and follow everything that Nate and Reverend Katie just mentioned on extreme heat is a silent killer, but the damage, we don't have to lose any lives due to heat. Heat deaths and risks are preventable if we take the correct measures. So, having people being aware about that and, getting trained can really save a lot of lives. So I will just end with that. Thank you.
Thank you. And I think that where the answer for that question went, of having your doors open, of talking to your neighbors, of thinking through what are those small life-saving preventive things that you can just carry around in your car with you. Those are things that's not limited to heat. You can address whether, if you live somewhere where heat's not a concern, but storms are, or power outages or wildfires. Again, having starting to build those connections and those practices are the ways that we are going to we're going to get through this, but by having those connections. That's the only way through. And so I really urge folks, please do join us. The link has been in there multiple times. It's an easy one to remember, apha.org/extreme heat. We'll be sending out a follow-up with more links and resources to all of you. And thank you again so much to our panelists. I really appreciate your time, and thank you to everyone for joining us today.
Thank you so much. It's my honor.
Thank you, everyone.
Thank you.